Welcome to the future where mental health services are truly listening to the needs and interests of people with mental health challenges. Let us show you what is happening here.
Perhaps the most important change is that there is a choice in the options that people have for their therapies and support. They are in control of what happens to them. A major principle that exists is that one size doesn't fit all. This means that each person is seen as unique and the best guide to their own experience.
And this is true regardless of what we call ourselves, whether it is people with lived experience of emotional distress, trauma, mental health challenges, or neurodiversity.
If you have ever been in an acute hospital, you will be delighted to hear that acute beds are now in a range of settings. Most are in the community and are committed to healing through strengths-based, solutions-focused therapies and support.
Gender safety and the safety and inclusivity of LGBTQI+ and culturally and linguistically diverse consumers are priorities in these settings.
There is a new and exciting understanding that we all have different needs due to biological and cultural factors. We all know that safety is fundamental to any treatment being successful.
Therapies and support are now offered in the home, in community organisations, peer-led agencies, and in respite centres. And there is a great balance between medication and meditation, as well as yoga instructors and psychiatrists. In fact, there are multidisciplinary teams who work collaboratively with us in developing and providing options.
The predominant groups of workers are peer workers and therapists who have a holistic approach to therapy, which comes in many different varieties, including trauma therapy, art therapy, music therapy, pet therapy, narrative and group therapy, which are all funded through Medicare.
All of these services are easily accessible with simple ways of moving from one service to another, especially when we are in crisis.
And the settings have changed. Nature has been recognised as an integral component of healing, and the locations of services are usually in gardens, forests and bush settings, with lots of light and interconnection between the inside and outside. We even spend time gardening when we want.
In addition, there is access to additional services such as pet boarding, childcare, and dentists.
Co-design, co-production and collaboration are the foundation of the treatment service system, and all decisions about service design involve people with lived experience of mental distress.
There has been an increase in the number and roles of peer support workers and consumer consultants. In fact, consumer consultants have a key role in service design and operations.
This valued and respected peer workforce are diverse in their mental health experiences and backgrounds and embody empathy.
Supported with ongoing training, professional development opportunities and award schemes. This training and the entire design of the mental health system was trauma-informed.
An exciting development is the establishment of a collaborative centre. It has brought together consumers, carers, researchers and clinical services to undertake research on the best trauma-informed models of intervention and treatment, focusing on what we see as the issues and the best ways of addressing them.
The centre not only offers year-round support, but also offers outreach services and travel compensation for regional and rural residents.
One of the many projects happening in the centre is the impact of the social determinants that create and exacerbate some of our mental illnesses, such as lack of housing, employment, addiction, and domestic violence.
As a result, there is a shifting understanding in the broader community that is what is happening to us is important, and as a result, we are treated with compassion, love, and equity.
And last but not least, there is a peer-run service based on the New Zealand model of Peripono.
So exciting.
So affirming.
So healing.